back to empowerin.com. I'm Caroline Porter Thomas here with another inspirational message for the week to keep you going. So right now we are preparing for nursing school. Before you start, you may have a lot of questions. There's a lot of terms out there that may not be familiar with you. I was very lucky because my mother was a nurse, so she was able to steer me through, guide me and just help me decide on the correct path for me. But I know a lot of you guys don't have my mom, actually all of you. So I'm here to kind of make it a little bit easier for you. So a lot of people ask me, what's the difference between an LPN or a registered nurse, RN, or bachelor's degree or accelerated degree. So let's start with the LPN, which is called the licensed practical nurse. So there's a few benefits of having the LPN, the licensed practical nurse, and that is that all the requirements you need are basically like a high school diploma, and there might be like a test that you need to take, like an entrance exam, but your scores might not have to be like as high. And it's a fast accelerated program. Usually in about 2 years you can have your license and you can start working, which is great for a lot of people who absolutely have to start working right away. There are a few drawbacks. Some institutions may require that you have some classes already under your belt. These prerequisites may take you up to a year or more to complete. So you really want to consider that. We'll go on to the RN, or the associate degree RN. So this one, the only difference really is that you're getting your associate's degree. So again, you only need like a high school diploma, and in about 2 years you'll be ready to work. Again, though, you'll want to look at the prerequisites that will be needed, and that could take you up to a year to complete. In all honesty, I don't know of any associate degree programs that do not have quite a few prerequisites. So you want to definitely take a look into that. The other thing is a bachelor's degree. So to get your bachelor's degree, which is what I did, you have your 2 years of the level work, and then you have your upper division nursing school. Those 2 years before, you're doing all of the prerequisites for like your science classes and stuff like that. And then they also, throw a few more classes in there to help you get a well-rounded bachelor's degree. So this whole process takes 4 years. But actually, if you think about it, getting your associate's degree takes 3 years realistically, maybe even more. So you just want to take that into account. The other thing a lot of people don't know about is what's called an accelerated BSN program. This isn't offered everywhere, but if you have a bachelor's degree in any other field, doesn't matter what it is, you could do this. There's no reason why anyone that has a bachelor's degree in any field should be getting their LPN or their associate degree RN. It doesn't make any sense. Because you already have a bachelor's, you can go back, you might have to do like some science prerequisites, but with that, you'll be able to, once you get the science prerequisites done, you'll be able to go on immediately into upper division nursing, and it's an accelerated program made specifically for people that already have a bachelor's degree. So another few things that I wanted you guys to look at: when you are applying to schools and you're kind of evaluating what kind of school you want to go to, you'll want to look at their pass rates. They're on the boards. And this is called the first time pass rate. You want to see pretty high scores, like in the 90s or so. Be careful though, because a lot of people say, oh, this school has 100% pass rate, like this must be the best. But you want to kind of be careful. I think, me personally, I think you want to be careful when it's 100%, because that means that some people that could have possibly passed the exam maybe were not passed through the actual nursing program. So, the attrition rate is very important. The attrition rate is actually the people who started and the people who weren't able to finish. So let's say if you have a school that starts out with 60 students and they only graduate 12, but they have 100% pass rate on the boards, then that's something that I would definitely want to take into consideration. Now there is, most of the time it's sad, but even people that make it this far, there are some numbers, there's a lot of people that aren't able to make it through. So there is going to be some drop in the number usually. But you want to look for numbers that are kind of like, start with 60 and, 50 graduate, and they have like a 92, 93% first time pass rate and on the boards, which is the NCLEX examination. And I like the number 90s because that means that, most likely they didn't fail people who could have passed. And the thing is, for you, the first time pass rate is not the biggest deal in the world. It's important for the nursing schools because they need their rates to be high so that, they can keep their accreditation and it looks better. But for you, you are actually able to take the NCLEX examinations. I don't even know how many times, but I knew people who took it, I guess I knew people who took it 3 times. But I think you could even take it more than that. So for you, it's not as big of a deal. You just want to make sure that the school's well-rounded and that, they're not failing people who could have passed. So again, my name's Caroline Porter Thomas. All the information and more that I just told you about is here in my book. It's called How to Succeed in Nursing School. I hope you can see it. And the best place to find this book would be on Amazon.com. You can just search the title, How to Succeed in Nursing School, or you can search my name, Caroline Porter Thomas. Either way, you can find the book. And please, 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 if you have any more questions or need clarification with anything, email me anytime. My email address is empower.rn@gmail.com. That's empower.rn@gmail.com. Alright guys, I hope this helps, and I hope you are enjoying the summer, or if you're watching this in the winter, I don't know, I hope you're enjoying your time. So I will talk to you soon, and until next time, love you guys, bye.